Other thing that's missed here, really important, is if you're going to let that patient go home, what do you tell them about their anticoagulant?
Primary care physicians, emergency physicians, urgent care physicians, we're a brethren. Unlike specialists who know what's coming their way, we get an undifferentiated patient with a problem.
Welcome to the 11th Annual Urgent Care and Emergency Medicine Conference.
There's a known culture here that this is not the typical academic residency lecture. This is speaking to adult clinicians who are going to leave here and go take care of patients.
Yeah, it's a great group of speakers with a ton of urgent care, emergency department, family medicine experience.
I think the length of time for them is great. I love to be up early in the morning, get all my learning done, and then be able to have the afternoon to go see everything. And everything is applicable. I can take little bits and pieces from everything and apply it to my practice, to the population I take care of.
It's incredibly practical knowledge, and it's actually stuff I use daily.
My responsibility is to provide them with the best science.
The primary care physicians, primary care providers, in both office setting, urgent care, and ER. We're brethren, and we're going to work through this together, and that's the beauty of this conference.